All right. Hello, and welcome to Conversations in the Kitchen, where we try to tackle hot button nutrition topics. My name is Judy Donnelly. I'm the Nutrition Program Coordinator at the Dempsey Center. And with me today is Dr. Leslie Bradford. So Leslie comes to us from Maine Medical Center and Maine Medical Partners. She's a native of Maine, and she's a practicing gynecologic oncologist at Maine Medical Centers and Maine Medical Partners. She completed her medical school training at the University of Vermont College of Medicine, followed by a residency in obstetrics and gynecology at the University of Wisconsin Hospital in Madison, Wisconsin. She returned to New England to complete her fellowship in gynecologic oncology at Mass General Hospital. She then joined the faculty at the University of Massachusetts. She finally came back to Maine in 2017 and now serves as the Director of Research in Gynecologic Oncology at Maine Medical Center, Maine Medical Partners, and is an Associate Professor at Tufts University School of Medicine. If that's not enough, in addition to overseeing the Gynecologic Oncology Clinical Trials Program, she's a co-PI on the institution's NCORP grant, serves on the NCI Gynecologic Cancer Steering Committee Ovarian Cancer Task Force, and is an active mentor for resident and medical student education and research. She has a strong interest in the impact of obesity on cancer risk and recurrence, developmental therapeutics, and minimally invasive surgery. Welcome, Dr. Bradford.
Oh, thank you, Judy. It's great to be here.
Great to have you. So our hot button topic for today is the anti-inflammatory diet. And Leslie knows a lot about this, and we've got a recipe that we're going to be preparing, just talking about the anti-inflammatory diet. But there's a handout that's posted to the website on the Mediterranean diet. And we really look at the Mediterranean diet as an anti-inflammatory diet. It's predominantly foods that are very close to their natural form. Lots of colorful fruits and vegetables. Grains tend to be whole grains. You know, it's foods that give us nutrients that help us to reduce inflammation. So what I'd like to do is have Dr. Bradford talk a little bit about what inflammation is and how does that impact risk of cancer?
I will say, so there are a lot of studies looking into this concept of inflammation, and it can get really, really complicated, and we can go into a molecular level, but I think the broad scope of things is that your body is supposed to sometimes be inflammatory and sometimes supposed to be anti-inflammatory. So cells secrete what are called cytokines, and usually there's this balance between pro-inflammatory conditions and anti-inflammatory conditions. An example I use is that if, God forbid, you had a parasite, for instance, you want your body's inflammatory system to help get rid of that. But there should be a balance with anti-inflammatory markers as well. And it's when that balance is upset that things don't work well. I think this past year has kind of been an example of what it feels like to be constantly under stress. On a cellular level, when your cells are constantly exposed to inflammation and inflammatory cytokines, they feel stressed. And when cells are stressed, they don't work properly. And so that's where all of those normal processes can be interrupted, whether it's abnormal cell division or proliferation and growth. So we see that as kind of this underlying cause for a lot of diseases, not just cancer, but chronic disease, be it diabetes, high blood pressure. But it definitely is implicated in many cancers, which is why I think so many people have an interest in kind of trying to tackle it beforehand. How can you prevent cancer or prevent cancer from coming back by adopting a more anti-inflammatory diet?
Yeah, so you've done quite a bit of research on the impact of weight status and how that impacts inflammation. So there's a connection there, right?
There is. We know that being overweight or obese is associated with developing cancers. There are 12 different cancers that are associated with obesity. So it's something where that can be really scary, but that's also something that we can address and we can modify. So you can reduce your risk through diet, but exercise is also very anti-inflammatory. Any amount of exercise is good, whether it's 10 minutes or 60 minutes. It's good for your mind, your body, your soul. So I always like to throw in a healthy diet pitch also with a pitch for exercise, because the two together can really help to reduce your risk of cancer.
Yeah, that's great. Thank you. Good explanation. You know, the Mediterranean diet, you know, when you're eating foods that are close to their natural form, in particular the fruits, the vegetables, whole grains, legumes, you get a lot of fiber from those foods. And fiber tends to help people feel full and satiated for a longer period of time. So, you know, a really good reason to kind of adopt a Mediterranean diet approach is that you start to eat more of those foods, you feel more satiated for a longer period of time, and it can have a really positive impact on your weight status. So if you're trying to take off a few pounds, following this type of diet can be helpful. It's still a matter of paying attention to your portions to make sure that your fuel intake is in the right range. But it's certainly a very positive first step to start moving in this direction. So we've got, as part of this series, we've been having conversations and also doing a little bit of cooking. So a second handout that is on the website is for this recipe called a lemony mustard salmon salad. We chose this because salmon is a type of fish that it's high in fat. And the type of fat that you get is in part omega-3 fats. So Leslie and I are both, you can't really see her bowls and her counter.
No.
But she's got some recipes, she's got her ingredients all set up. And this is a great thing because for the last year, I've been doing these cooking classes here online. And when I go to do the taste testing part, it's just me. It could taste terrible, and I'm going to be saying, oh, this is really good. So you're going to be my checker.
It's good. I've already made it. I can vouch for it.
Nice. So we're going to start making this, and I'll talk a little bit about the ingredients as we go along. And this is such an easy salad to make. You could, with summer coming, it's nice to have some cold salad ideas. The salmon is going to be a great source of protein to top your vegetables. So I usually use the big can and just kind of make a double because it's just really good. But this is just right at Hannaford right near the tuna fish in the canned fish section. It's Rubenstein's Alaskan red salmon. From a cost perspective, it's the least expensive way to buy your salmon. And you can buy a few cans of it and just have it in your pantry. So, when you're trying to figure out what you're going to have for lunch and you think, oh, that salmon salad would be good, it's not a time that you're going to run out and go to the fish store and to get some salmon. So you've got it right in your pantry, and it costs a lot less than buying fresh salmon. And it's wild Alaskan salmon. It's like the cream of the crop. So this actually has skin and bones in it. So I'm going to take this over to the sink and just drain it a little bit. It's not the skin and the bones though, because that's the good part. So I know that some of you heard me say skin and bones and you're like, I don't know if I'm going to like that. You want to get it with the skin and the bones. We're going to talk about omega-3s in a second here. A lot of the fat is actually in the skin, and that's where a lot of those omega-3s are concentrated. And then in terms of the bones, so I'm going to dump this in my bowl here. So you can kind of see here, I'll pull this up. Here's the skin, and I can see, you can't really see it, but I can see all these little bones. When I mash this up, everything just kind of comes together, and you're not going to taste any bones. You're really not going to know the skin's there. So as I said, this type of fish is a really good source of omega-3s. So what I'd love to do is I'd love to have Leslie talk a little bit about omega-3s and how they can be beneficial to people who are going through cancer treatment.
Yes. So omega-3s are great. I think of it as that natural supplement, that healthy fat that's going to benefit you from your head to toe. So we know there's been a lot of research looking at how omega-3s can help boost immunity. So boosting the immune system can be helpful. It's been studied a lot in terms of cardiovascular health. For patients who are going through cancer treatment, though, I think it's also especially important to think about getting a healthy source of omega-3s, because there's a lot of literature looking at how omega-3s prevent what we call neurotoxicity, damage to the nerves. So that can be neuropathy and numbness and tingling in the hands or feet. So this is just one strategy to help prevent that. But also a more general neurotoxicity that many people experience is the phenomenon of chemo brain. So a way to keep your brain healthy is with these healthy fats. So there's most of the, check with your doctor first, and usually you'll meet with your pharmacist too in terms of if you are taking any supplements, to make sure it's not going to interact with any other medications you're taking. But getting your omega-3s through your diet is a really, really safe way to do that. And I love that you chose the salmon, because it's not just the omega-3s that we're getting here. We're getting really, really healthy proteins as well. And the omega-3s specifically, and with the fish, do help to prevent weight loss during chemo. I think that's important to mention. As we get older, we lose muscle mass. So that's not weight that we really want to lose. We want to maintain our muscle mass. Patients who are going through treatment for cancer, especially chemotherapy, are at a much higher risk for losing a lot of muscle mass during treatment. And if you're not feeling well, you're not going to be going and lifting weights. But if you can maintain your muscle mass while you go through treatment, you will recover faster when you're done with treatment. So that's why nutrition is so important.
Yeah, that's great. I think that's such an important message to share, is that message that your recovery will be quicker if you keep your nutrition and your strength up during treatment. We try to get people, appetite can be thrown off, taste buds can be thrown off. There's so many things that can really influence someone's ability to stay well nourished. But this recipe there's more that we can talk about here. So I've been kind of pulling together the dressing. Are you working on your dressing too?
I'm doing my dressing in a jar because I liked it so much. I'm going to use it with my salad with dinner tonight as well. So I'm making extra. Perfect. And that way I can just shake it up in the jar. And if you really like lemon, I zested my lemon before juicing it. So I have a little bit more lemon in the dressing. I thought it was.
Yeah, I love that.
Don't want to waste the lemon.
Don't want to waste the lemon. And that hits on a perfect topic for people who are going through treatment and their taste buds are off. Sometimes people will be talking to me and they'll be like, I can't taste anything. My taste buds are just messed up. And so what we'll use, one good suggestion is, as long as people don't have any mouth sores or anything, is to add a little bit of lemon, whether it's lemon zest or some lemon juice to your food, because you've got these taste bud centers in your mouth that detect lemon, they detect salt, they detect sugar. And sometimes you can just really brighten up the flavor of your food by just putting a little bit of lemon juice, or lemon zest is a great idea as well. So I, in my bowl here, have the mustard and the lemon juice. I'm actually not putting, and I've got olive oil out here. This is a great oil to add to your dressing. There's actually quite a bit of oil in the fish. So I'm not actually going to put any extra olive oil in there, but your taste buds and your preferences are your preferences. So I just encourage people to look at recipes as guidelines, and you kind of tweak them the way you like it. And so I'm going to put just a pinch of salt in the dressing, and the recipe calls for cayenne pepper. So if you like a little bit of heat, that's a great way to go. I'm just going to put a little bit of black pepper. I tend to like that a little bit better, and it's not quite as spicy. And then we're just going to mix this up. And, there's not too much else to do. I'm going to dice a little bit of celery to add some pizzazz here. So I've got some celery sticks that I'm just going to slice lengthwise. And then what I do is I just pull the whole pile together, and you want to protect your digits. So as your knife kind of gets closer to your hand, your fingers sort of come up into a little bit of a claw shape as you're going through your pile. You don't really have to move your knife too much other than up and down, and you can use your other hand to push the celery right through. So here we've got some nice diced celery that can go into the bowl. And I think we're ready to just mix everything together.
Smells so good.
And I also didn't buy, I also didn't do the fresh parsley, but you know what? We've got a community garden at the Dempsey Center, and we grow a ton of herbs. And so this is some dried parsley, which people are more likely to have on hand. So just decorating the top when you're ready to serve with some dried parsley is a nice way to just add a little bit of aesthetic appeal. But I would also say that spices and herbs are pretty concentrated sources of anti-inflammatory nutrients. So learning to use them and use them in fairly generous quantities is a very safe way to get some anti-inflammatory nutrients into your system, as opposed to using supplements. So we talked a little bit about that, but do you want to add anything to that idea of supplements during treatment?
Sure. I find it's very natural to think of, if you've been diagnosed with cancer and you're about to start treatment, trying to think of, I get asked all the time, what should I be doing for my diet? Are there supplements I should be taking? We could talk about supplements for hours in terms of the pros and cons and benefits of them. If you're going through chemotherapy treatment, though, I think it is important to talk with your doctor about any herbs and supplements that you're taking, as well as to talk with the pharmacist, because there can be interactions with medications. A lot of herbs and supplements, we think of them as being all natural because they're derived from plants. Chemotherapy is also, many chemotherapies are also derived from plants. So that's the contrast. And so I really think of them as medicines. And knowing that there are some supplements that can be safe to take that won't interact with chemotherapy, that can be beneficial, but there are others that can actually be quite harmful when you're going through therapy. So it might be safer to stop taking them either before surgery or before you start chemo, and then maybe consider adding them in afterwards. So I really try to promote, if you are interested in either having more anti-inflammatory aspects or healthy sources of protein, rather than focusing on taking a pill, trying to get it through your diet. That way you're actually getting what you're eating. You're not having to worry about the quality of the supplement that you bought. And it's tastier. You don't have to remember to take a pill.
Yeah, great. So we thought that since we were both doing the same recipe, we would just add our own little flair to it. As I said, recipes are guidelines. And so I've got a little bed of greens here. I've got some baby spinach. It's just a versatile green. You can use it in so many ways. So I typically have that on hand all the time. Definitely contains some good anti-inflammatory nutrients. But you could use arugula, you could use deep green lettuce leaves, whatever you've got on hand really can serve as a nice base. And then what I thought that I would do, just to add a little bit of Judy flair, is add a little bit of red cabbage. So I have some red cabbage that's left over from another meal that was in the fridge. So I'm just going to slice this really thinly. What I like about cabbage is that it's a member of the family of vegetables called the cruciferous vegetables. And the cruciferous vegetables have some pretty powerful anti-inflammatory and other supportive nutrients. So as you think about what you eat throughout the week, foods that are part of that cruciferous family are great to include. So other examples would be Brussels sprouts, broccoli, cauliflower, the cabbage family, kale, all cruciferous vegetables. So I'm going to decorate my little greens with some cabbage, and then I'm going to top it.
I love that you're making your plate so colorful. I find that helpful too when trying to think of how do you incorporate more vegetables or more of a plant-based diet even. And if you think of just having color on your plate, that can often be a really easy way to have fun with it.
Absolutely. And it adds eye appeal to your food. And so when you're not really feeling that hungry, your appetite's thrown off, I think that if your food looks nice, it may help appetite. It just looks pretty. And the preparation can be a little artsy.
That being said, I of course went with the monochromatic theme at bread. I had chives in my garden, so I have a little like windowsill herb garden, and actually something that a patient taught me, and I'll hold it up. So when I chop my chives, I don't use a knife anymore, especially if you're going through treatment and you're having issues with neuropathy, or say you had surgery and you have lymphedema in a hand and it's hard to grasp a knife. A set of kitchen shears are great for chopping up herbs, and then you don't have to worry about actually having to hold the knife. So that was
Lovely.
Yeah. And then I had some pumpkin seeds left over, so they're green, going on my green and more green.
Well, we want to see it when you're ready.
I'm gonna hold up my plate.
Ah, lovely.
I can keep it on. So a little extra crunch with the pumpkin seeds as well.
Yeah, beautiful. Very nice. All right. Well, I think we need to do a taste test.
All right.
Let's get to watch us eat a little bit. Oh, I didn't put all my dressing on here, but we're going for it anyways.
I give it a thumbs up.
Mm. 2 thumbs up. As I always kind of encourage people to do a first bite for taste and just kind of be thoughtful about the ingredients that went into the recipe. And for me, I'm tasting mostly mustard and not a tremendous amount of lemon. All that means is put more lemon. You can just spritz a little bit more. I've got the other half of my lemon here. I can just spritz a little bit more on the top, and it's just going to add a little bit more of the lemony flavor. So it really, whatever your taste buds are looking for, you can modify the recipe. How is yours? Is it perfect, just the way you were hoping?
It's great. I tasted my dressing beforehand, so I think I had a heads up with that. But I love it. This is going to be my lunch tomorrow. I like that this recipe is really portable, so that's also nice if you're needing to take it for lunch or a snack, or if you're going to celebrate National Cancer Survivors Day with an outdoor picnic. This is an easy, transportable meal that you can share. It'd be really good too as a sandwich. So
it would be very good as a sandwich or spread on a piece of toast. Lots of different ways to use it. Yeah.
Also, it's very mild. So if someone is not a super, if you're not a big fan of fish or salmon, I know some people are a little bit worried if that turns you off, but it is mild. And I think even if you're not feeling well, I'd ask you to try something like this. Protein can actually help manage nausea during chemotherapy. We often think my stomach doesn't feel good, I'm just going to reach for some saltine crackers. Those don't really settle your stomach in the same way that protein can. So really trying to maintain healthy protein intake during cancer care and your cancer treatment can be really beneficial. So sometimes you can have a cracker, but whether it's some peanut butter or even some tuna salad or salmon salad, that can sometimes actually give you some more benefit in terms of good nutrition and management of nausea.
Oh, great information. So I think that's what we have for you today. I want to thank Leslie again for joining me. This has been a bunch of fun. And thank you guys for joining us today. And we hope you have a great Survivor Day. So long.
Bye.